Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Laboratorial news. This audio podcast is part of a LabZtorm. This audio podcast is part of a Corral Broader, and this audio podcast is part of a Storm Robotics production. In this audio podcast, in this audio podcast, as part of a series in relating to peer reviewed and published works from 2020. Now looking at sort of the results aspects of and informing informing some sort of initial data collection or sort of data collection as part of as part of sort of as part of this works this peer reviewed and published works from 2020. So the team sought to obtain 1,000 responses from 8,000 members utilizing the RPSG platform of the RPSG platform at the time at the time of this works, and a total of 574 RPSG members members were a total of 574 members um, uh, had had participated in the polls, representing about just under a sort of 10% response rate, just under a sort of 10% response rate, and specifically around a 7% response rate. And being an international social media platform, the responses had demographics with varying ethnicities, age, and gender representation. The polls did not seek to collect data for level of education, employment, and or relation and or sort of relationship status. So in in the peer-reviewed and published works, there are varying overviews in regard to in regard to the data in regard to the data collected against and linked to the different polls implemented. So in around poll one, the number of respondents who polled, for example, yes, they would see a physician other than their own. Over 50% um, respondents agreed, and 4% around 4% disagreed on whether they would be content seeing a physician that they would not normally see. The results from the polls from poll one inform that given sort of today's sort of technological advances and use of social media, for example, for information for information sharing and capacity to support informed decision making, CKD patients or those healthcare service users would see another healthcare professional who know more about the tests and investigations and impact of the results. There's graphical in the peer reviewed and published work from 2020. There is sort of the there is a sort of a graphical data sorry representation in around the data collected linked to poll one. So now when so at the same time, now looking at when considering how can healthcare professionals, better understand or appreciate the state of a patient or healthcare service users with a chronic illness? And communication with healthcare service was deemed the most important element. The proposition of respondents who polled in or voted for communication was in around 33%. This poll or poll two indicated that healthcare service users want more communication with healthcare professionals. The results from this poll also demonstrated that healthcare service users want opportunities to ask questions. So, for example, and around 9% of respondents and healthcare and professionals, and in related to health professionals should listen to healthcare service users or patients more. 12% respondents. There was 12% in around the 12% in around the response in amongst and from respondents, and then more opportunities to communicate about laboratory tests and investigations. In around laboratory tests and investigations would in regard to more opportunities to communicate about laboratory tests and investigations would also look to increase health literacy. And similarly, when healthcare service users were asked if they would access a system a system wherein healthcare professionals, for example, allied health professionals such as healthcare scientists and in regard to healthcare scientists, and in regard to primary care and in regard to primary care and community, if where they could tell them about the tests and investigations, tests and investigations. uh, 77% of the respondents polled in yes, and around 17% are answered as no for this particular question. And given that patients or healthcare service users are being encouraged encouraged towards self in around self care, and more and where CKD being a sort of a clinical chemistry or laboratory sort of based or condition. Healthcare service users want to gain more understanding of investigations and the impact of results through a healthcare through healthcare through healthcare scientists, since these are professionals or healthcare professionals who know about the disease intricately. Access to healthcare scientists would be especially important for healthcare service users in amongst CKD stages 3 through 5, where laboratory investigations tend to be more frequent. In the peer-reviewed and published works, there is graphical data that highlights or informs of the poll and around the relating to the poll data in sort of graph for in around the poll data graphically. Now, when asked about technology and its usage, So, for example, what tech solutions are available through your general practice, or through a transplant division, a portal allowing access to medical records and laboratory results scored high in around 26%, which demonstrates that around 74% of healthcare service users do not have a portal allowing access to medical records. A total of 22% of respondents checked lab tests or investigations through general practice and or a transplant division, a transplant division and and online appointments booking and appointment reminders, which means that which meant which means or meant that 78% of healthcare service users healthcare service users um, which meant that which meant that that 78% of healthcare service users do not have a portal allowing online appointment booking or appointment reminders through general practice and or transplant division. Digital in regard to digital communication or digital comms. So, for example, email, text messaging. Um, had been utilized by around 17%, and 17% of the respondents, indicating that 83% of the healthcare service users do not have a portal allowing digital comms through general practice and or transplant division. Um, in regard to repeat sort of prescriptions, for example, repeat prescriptions was opted by about 15%, 15%, and 15% of the respondents, which also demonstrates that 85%, 85%, 85% of healthcare service users do not have a portal allowing repeat prescriptions through general practice and transplant divisions. Uh, and what was also intriguing was that patient-centered education. So, for example, around laboratory investigations, medications, etc., is or was low, and around 3%, indicating that 97% of healthcare service users do not have access or receive person-centered do not have access or receive centric education in around their complaints in around their complaints. Only 1% agreed when asked about remote laboratory advice or education through a healthcare professionals or healthcare professionals, which highlighted that 99% of healthcare service users do not have access or receive laboratory remote education through general practice and or transplant division. This also reiterates that online apps and electronic patient records or EPRs are not supportive, because having access to test results without the educational knowledge behind them is not complete care. In regard to in the peer-reviewed and published works from 2020, there is graphical data that links to this particular poll as well. Now, 26% agreed that when asked how likely you are to use to utilize or use future or prospective tech for educational support from AHPs, allied health professionals, for example, healthcare scientists, to receive, for example, text messages or comms or communication regarding laboratory tests and investigations through through an app on a on and through or through an app on a smartphone. So, for example, to support educational requirements, again, regarding to the test to varying laboratory tests and investigations, linked to the link to CKD. So 25% agreed to access a remote healthcare allied health professional, AHP, or healthcare scientist for education through through an app on a smartphone, and 33% were likely to to access EPRs to access we're likely to access a remote healthcare AHP, allied health professional, or healthcare scientist through a computer or an app from through a computer or an app. And for CKD healthcare service users, it is important that healthcare healthcare professionals, so for example, allied health professional, healthcare scientists, i.e., those who know about the tests and investigations behind pathology and scenarios, provides educational support surrounding laboratory investigations and the impact of the results. This is perhaps consistent, consistent with a healthcare service users having access to results through electronic patient records, but an added stage is required whereby healthcare service users have education support have educational support to the interpretation of results. The peer reviewed publication from 2020 has graphical data that links to the poll in regard to poll 5 in as part of the works. That draws this audio podcast to a close. This audio podcast as part of Laboratorial News. This audio podcast as part of a Hella LabZtorm. This audio podcast as part of a Crow Brother. This audio podcast as part of a Storm Robotics production.